hopefully some more people will arrive as we go on. So I'm just going to share my screen. So to start off with, thank you everyone so much for coming this evening to the Cambridge Global Health Café. These Global Health Cafés it started in Cambridge by Cambridge Global Health Partnerships, and we Students for Global Health Cambridge have paired up with them this time to bring you this cafe. Just to quickly start with some event logistics, we're going to be recording this event until the Q&A session. Please do mute your microphones, and I think everyone already has, but and if you feel comfortable, do turn on your camera. It's nice for our speakers to see some faces, so they're not just speaking to a blank screen. So just as an overview for this evening, we're going to start with an introduction of Students for Global Health and Cambridge Global Health Partnerships. Then we're going to hear from Alastair Blake and then Rhiannon Osborne, and then we'll end with, in the second half, we'll have some discussion and some questions and answers. Like, do feel free to send through your questions throughout the event, either in the chat to everyone or just to me personally, or at that point in the evening, you can also raise your hand and we can invite you to unmute and speak at that point. And we'll aim to finish around 7 this evening. So just to start off with, just to give you an introduction to Students for Global Health Cambridge. At this point, I'll introduce myself. I'm Christine. I'm the branch president for Students for Global Health Cambridge, and I'm also a 4th year medical student. So Students for Global Health Cambridge is part of the National Network of Students for Global Health UK, which is a network of students who are so aiming to empower these students to affect tangible social and political change on local, national and global levels. And in Cambridge, we've specifically been aiming this year to raise awareness of health issues within the local Cambridgeshire community, educating ourselves about local and global health issues, challenges and solutions, and campaigning for positive health policy change at university, local and national levels. And we achieved that via 6 subcommittees, everything from race and health, poverty and health, to a WHO simulation. And we host campaigns, events and panels, as well as doing training and capacity building for our members. And we're really excited to have partnered with Cambridge Global Health Partnerships for this cafe today. That's kind of it from me on an introduction to Students for Global Health, and I'll pass over to Evelyn from Cambridge Global Health Partnerships.
Thanks, Christine. Hi, good evening, good morning, I think, for some of us, because I know that Alastair is joining us from the US. It's really exciting, like Christine said, for us to be collaborating on this, and it seems strange, I suppose, that we haven't collaborated more, given that we're Cambridge Global Health Partnerships and you're Students for Global Health. So hopefully this is the start of what will become a long and strengthening collaboration. So Cambridge Global Health Partnerships is a charitable program that sits on the Cambridge Biomedical campus. It was started some nearly 15 years ago and has grown out of Adam Brooks and Cambridge University hospitals. And really because there was recognition 15 years ago, and the case is still the same now, that there's many staff and students who are attached to the hospital, working at the hospitals in Cambridge, who are interested and involved in global health. And we as individuals benefit from our involvement in global health. Our partners benefit, but also our employing institutions benefit. And so what CGHP does is to try and bring some structure, advice and support around that really enables people who are interested and already involved to do what they do safely, effectively and ethically. We have a number of long-standing health partnerships, and we also have tiers of support. So some people will get grants from us, some people will be involved long-term in our health partnerships, whilst others might go off with a different organisation. for example, MSF, but they will have some support and receive some advice from us. For students specifically, we have an elective bursary scheme that in previous years, when electives have taken place overseas, have given grants and advice and support for students to be for their electives. And more recently, we've made that more targeted, offering opportunities within our established health partnerships. And this year, I know that there's no overseas electives taking place, but we're working with people in the university to try and offer some alternatives and give people who are interested more of an insight and exposure. And I guess what we're also aiming to do is to think how throughout careers people can have global health as part of your careers. And so I know that the presentations tonight will touch on that, but sort of started with the elective bursary scheme. And then with trainees, we're about to launch a global health fellowships, or we're just recruiting some senior trainee global health fellowships. And then obviously we work the whole way up through to consultant level, and also kind of across the whole healthcare workforce. So clinical, but also non-clinical. So kind of management staff have been involved in our programs, and a real focus on multidisciplinary team working. That's probably enough from me. And we'll obviously have more discussions later, and really look forward to hearing from you and connecting with you beyond this evening. Thank you, Christine.
Fantastic. Thank you so much for that overview and relevance to us. So with that, I'd like to hand over to our first speaker to speak about his experiences of global health, especially as a student. So Alastair Blake is the Vice President of Clinical Partnerships at Inference, and he's also a former University of Cambridge medical student. So over to you, Alastair.
Thanks so much, Christine, and thank you all for the opportunity to join you and speak. It's a real pleasure and an honor. And I have to say, the work that Students for Global Health are doing sounds fantastic, and also I personally had a fantastic experience doing a project which I'll tell you a little bit about when I was a student with what was then called Addenbrooke's Abroad, but is now called Cambridge Global Health Partners. And so just to kind of briefly sort of give you a bit of background about me. So I was a medical student at Cambridge. I graduated in 2012 before doing my foundation years and some of core medical training in London. Then I moved to the US about 5 years ago to go to business school. When we moved to the US about 5 years ago to go to business school, and then worked in consulting, and now at a healthcare technology company called Inference that I'll tell you about later. And so what I thought I would do in this kind of, I wanted to keep it relatively short in this sort of 10-minute overview, was to tell you about three things. I wanted to give you a bit of an overview of what I did when I was doing this project with Cambridge Global Health Partners, and share some reflections on that. I wanted to then tell you a little bit about how that experience shaped and informed my subsequent decisions, because although I am a doctor, I've had a relatively more unusual career path, and I'm doing something a little bit more different than what many doctors do right now. And then the third thing I wanted to talk to you all about was what this may mean for you, and what some of the implications of what I've shared might mean for you guys as current students. And I know there's a broad range of folks on the call, whether they be medical students, nursing students, and students of other disciplines at multiple universities. So they're the three things that I propose talking about in this little overview. So let me tell you about that first thing, what I did. So when I was a fourth year medical student, it was back in June 2010. I was very grateful to receive one of those bursaries that Evelyn mentioned, to go to Botswana for a month as part of the health partnership that Addenbrooke's Abroad and the Princess Marina Hospital, which is the largest hospital in Gaborone, which is the capital of Botswana. They have a long-standing relationship, and I imagine Evelyn may nod and say if this is still continuing, but I imagine it is. And during that 4 weeks, I undertook a project around diabetic eye disease. Now, diabetic eye disease is obviously a preventable cause of blindness and is extremely common and increasingly common in sub-Saharan Africa. And what we did was, Cambridge having recently given a diabetic eye disease camera, a retinal scanning camera, to the hospital just a few months before I went on the project, the doctors and nurses were starting to gather data about a patient in an electronic database to be able to form one of the first diabetic eye disease registries. And so actually what they had done was just started collecting data in a very manual way. And what I did, along with the help of other colleagues at Addenbrooke's Abroad and colleagues there in Princess Marina, is we started to digitize and make an electronic registry of the patient data around diabetic eye disease. And obviously what that enabled was some subsequent analysis. We ended up collaboratively publishing a paper on with that data as part of an international collaboration with them and folks at Cambridge. And what I hope started off showing is that the value of capturing data as a first instance, and then also being able to analyze that to be able to share from a research perspective, and then hopefully to track and monitor care progression going forward. So it was a relatively simple thing that we did in terms of making an Excel with some macros and various things to make it have some fancy functionality. But essentially that was one of the core elements of the project. And it was a great experience going out there, working with the nurses to be able to sort of train them in how to capture the patient data in an electronic form, to also see and understand how the diabetic screening was undergoing in the wider sort of clinical workflow. And so that was what the project was, and that's one of the pieces of that was one of the core outcomes from the project, was being able to analyze the data and capture it in a digital form, which I think was helpful. And I know from keeping in touch with folks for several years thereafter, it was actually still being used. I wonder maybe Evelyn can give a more recent update, because it was over 10 years ago. And then just quite a bit of context about Botswana. I mean, this is down in the southern half of Africa. It's a country of about 2 million people. It's about the size of France geographically, and Gaborone is the capital with around 200,000 people living there. And so just to build on one of that, on the final piece of my first bit around what I did, I wanted to share some reflections about the experience. I mean, I had a few really, and I think these were really informed by the fact that I had the privilege of being able to go out there in person and to work with folks at Princess Marina Hospital. The first thing I realized is that there are obviously many different players helping to advance the aims of the hospital there. There were, I know Harvard, I know UPenn, I know there was a large drug company had a presence at Princess Marina, who were all trying to advance through academic collaborations, through research and other initiatives, trying to advance the aims of the hospital. So I realized that it's certainly a multiplayer space, global health, and that there are lots of folks contributing in their own unique ways. And that furthermore, as part of that multiplayer nature, there's also multiple disciplines, that lots of different folks, whether they be scientists, whether they be clinicians, whether they be people dealing with logistics and other things, all have a role to play. So that was one of my first impressions. The second reflection that I had from the whole experience was that infrastructure is really like a core requirement to be able to build sustainable and scalable change in the global health setting. And so I think that something like the contribution that Cambridge had made by providing some equipment was obviously a core piece of infrastructure there that enabled the diabetic screening program, but also things that are less tangible, like data collection and systems to enable data collection, are all pieces of infrastructure that are important in making sustainable and scalable change. So that was another key reflection I had, that I think is important as we're all on the call pondering about how we can make a contribution in global health. And then the third reflection I had was around the fact that where there are challenges in health systems globally, it's really a sort of systems level approach that needs to be adopted to help address and make that change. And particularly now in my subsequent career, where I've worked in Asia, I work obviously and live in the US now, but I worked as a junior doctor in the NHS, is that all health systems are broken in their own ways, whether that be in developed countries or lower and middle income countries. And that all health systems are trying to find the optimal point on what is known in the health policy literature, and many of you will be familiar with the iron triangle of healthcare, trying to resolve quality, access, and cost together. And obviously different countries are at different stages in this process, but all health systems are trying to resolve those three challenges, and that requires a real systems level thinking. So that's my kind of first bucket of things about what I did and what my core reflections were. And then the second two things I wanted to talk to you about were just a little bit about how this informed my career decisions and then what this may mean for you guys. So how it informed my career decisions is that I had a tremendous experience. I thought it was a really formative experience to do in medical school, to have the opportunity to go to Botswana as part of my elective. And it very much reinforced the fact that I really enjoyed clinical practice, and that's what made me go on to do core medical training in foundation years. But that piece in the back of my mind around, like, there are systematic and there are systems level challenges here that we need to address, made me realize that I wanted to address my own ignorance about learning about how health systems work and all the multifaceted ways that all the different players in the ecosystem of healthcare work together, or don't work together, as the case may be. And so what that meant that I wanted to do is I ended up doing a fellowship with the National Medical Directors Clinical Fellowship run by the Faculty of Medical Leadership and Management in London. So I did that for a year, and I'd highly recommend if you're thinking about learning more about health policy as you advance in your careers, looking at that opportunity, because I thought that was fantastically useful to get exposure to national policy making and work with some real senior leaders in the NHS. And then, having realized that I wanted to keep learning about health systems, I realized that I need to do some more education, to do some more formal education. So I ended up moving to the US to go to business school. I was at the Wharton School, which is part of the University of Pennsylvania, and had an opportunity to travel to Ethiopia with the guy who wrote the Affordable Care Act here in the US, and do some other work with health systems internationally and in the US as part of my studies at business school, which was great. And then subsequently to that, ended up working in consulting at McKinsey and Company in New York, again, working in the health systems practice. I worked for Asia's largest hospital chain, as well as several large hospitals in the US, again, just trying to stimulate my learning about health systems and how all the different players and how financing works, how logistics works, and all of these kinds of things, which I think ultimately are really important to just sort of understand the nuts and bolts of health systems, whether they be in rich countries or in more developing countries. And then now at Inference, and linking back to that broader question around infrastructure in health systems, I now work at a company where we're leveraging AI to advance patient care and to advance research by using healthcare record data. And really the kind of key implication for global health is that one of the core things that I think will advance the global health agenda in the coming 10 or 20 years is around capturing data and then using that data to accelerate research in underserved communities and to also improve patient care directly of data and the setting up of infrastructure to be able to do that analysis of data. And so I'm very excited that the company I work at now here in Boston will one day be able to have a scope of impact in countries that are not just Western Europe and the US, by using data to better inform drug discovery and also direct clinical care provision. So that's how that experience will sort of shape the career decisions I've subsequently made. And if there were sort of three things that I'd leave as potential, what this may mean for all of you from my experience, I think there's three things. I think one is to jump at any opportunity you can to get involved in any way you can. I think with the opportunities that Students for Global Health providing, as well as Cambridge Global Health Partners, I think they're all fantastic opportunities, and I'd encourage you all to get involved and to really throw your heart and soul into it. The second is that I would encourage folks to sort of learn as broadly as you can about as many different disciplines that will affect the way that the healthcare ecosystem works, whether that be around policy, whether that be continuing your expertise in clinical practice, whether that be learning about finance, learning about logistics, learning about international relations. All of these things have a bearing on the way that global health is mediated and affected. And I think that having a real learning mindset and trying to take as many opportunities as you can to learn is a great one to do. And that may or may not involve also, and I would encourage some of you, if appropriate, to do further study in the area formally. So whether that's doing a master's in public health, whether that's doing a master's in public policy or public administration, it's very common here in the US, or to do an MBA, a Master's in Business Administration, which is what I did. I think that can be a great way to consolidate and formally expand your learning. And then the third final, so what it means for all you guys is, I'd say just remember that there's lots of ways to add value here. There's in the field of global health, whether one can be the person doing the clinical practice on the ground is one way that's maybe more intuitive and familiar, but there are lots of different ways. As I said, there are whole misincentives around financing and challenges in logistics and all of these kinds of things that impact the way that care is delivered in many parts of the world. And there's all sorts of ways to be, and all sorts of ways that folks of different backgrounds and different disciplines can help with those challenges. So that's the third recommendation I'd have, is remember that there's lots of ways to get involved and lots of ways to add value. So that's it. Happy to answer any questions.
Thank you very much, Alastair. Yeah, that's fantastic, and it's really great to hear like your reflections and how we might learn from them, as well as current students. In terms of questions, we will probably leave those till our session on questions after Rhiannon's talk. But yeah, thank you very much for speaking. I'm now going to hand over to Rhiannon, who is a current medical student at Cambridge, but has experience in global health through various things, but including currently her work as Students for Global Health UK Policy and Advocacy Director. Over to you, Rhiannon.
Awesome. Okay. Sophie, can you go to my start slide? Although for those of you who submitted those questions, you can see that I thought your questions were interesting. So thank you. Firstly, thank you. Yeah, that slide is fine, whatever works. Firstly, thank you so much to Alastair for your talk. I really enjoyed that, and especially I think your reflections, because I think we have very different experiences in global health, but I think my reflections would actually be quite similar. So I think that is a really interesting takeaway, especially the parts about thinking about systems change and having that bigger, broader perspective when you're trying to make change to actually be effective. I really liked that. So this is going to be a very short presentation from me. Basically a little bit of an intro into kind of building on what Alice said, that there are so many different disciplines in global health, and what does that actually mean if you're trying to get into it, because it sometimes can be overwhelming to think, yeah, there are all these different things that you can do, but then how do you get into it? And then I'm going to talk a little bit about 2 case studies of areas of global health that I've been really closely involved with, and talk about the different disciplines and the different avenues for student involvement in those 2 different areas of global health. So hopefully that's useful and interesting, but yeah, happy to take any questions if anything is left burning or unanswered. So if you want to go to the next slide, please, Sophie. So a little bit about my background, and yeah, feel free to ask any questions about this later, I guess. So yeah, I'm a 4th year medical student at Cambridge, but I recently came back from taking time out of my degree to do work in global health. So I worked on global access to medicines policy with MSF in Geneva. I worked on TB research and TB program research for a Zambian research institute. And then I worked on the COVID response with the British Foreign Office in Zambia. And I think that was definitely where I got the sense of that multiplayer space that Alastair talked about, which can be great and sometimes can be maddeningly frustrating. And I'm now the Policy and Advocacy Director at Students for Global Health. And I work with a few other international global health organisations, such as the People's Health Movement. And at the moment, I would say the majority of my work is focused on climate change and health, but also health inequalities and health systems design. And yeah, I'm going to talk a little bit more about that. But first, I'm going to talk a little bit about what is global health. So if you want to go to the next slide. Yeah, so the definition of global health has changed a lot over the years, and it's definitely not something that is kind of agreed upon. And I think people who have different perspectives in the field have their own different definitions of what global health is to them. So if you look at the definition from 1997 on the screen, it's very much focused on health in other countries, which, and I think now most people agree, global health is not just something that happens elsewhere, it's a perspective, it's not a location or like a foreign country. And if you look at one of the more recent definitions in the bottom, it's now much more focused on justice, equity, rights, politics, a lot of those things Alastair talks about as well, all those different disciplines like law and democracy. So I think, yeah, it's really interesting to see how the definition of global health has changed over the years. And I think like something that's like important to note, but I'm not going to talk about loads in this presentation, is that if you go back to the roots of global health, a lot of it started as kind of international health, which is where you get the idea that global health is about infectious diseases, specifically in other countries. And a lot of that comes from kind of colonizing roots about trying to keep colonial soldiers healthy and preventing diseases from kind of arriving from the colonies. So this is where you get a lot of the misconceptions from, but it's also important to keep those power dynamics in the back of your mind, because many of them are manifested in global health today. And I saw some people had some questions about that, so we can maybe talk about that in the questions if that's something that people are interested in. So if you go to the next slide. So back comes to the question of what is global health, and I think there definitely isn't a definite list of what does and doesn't count as global health. I mean, my personal definition means looking at health in the broadest sense possible, including all the factors that determine health. So not just the social determinants of health, but things like economics, innovation, climate change, public policy, workers' rights, movement building, kind of all of those things which have such a big impact on our health. And in this lens, I think it's kind of impossible to be a good global health professional if you don't also think about the politics and the power dynamics that go behind all of those decision making. I think that makes you like a much more effective professional as well, especially if you're looking to achieve things like health equity, which hopefully everybody is. And this is one of the things I love about global health. You can kind of see in the middle, I put a list of lots of different things which I kind of think would come under the definition of global health. And one of the great things I think is that you can take any issue that you're passionate about and approach it from the lens of global health and health justice and be part of the global health community. So, I mean, you quickly realize that all of these things are connected. And if you're like me, you end up trying to solve all the world's problems in an afternoon and you get a bit tired. But there's so many ways to add value. And as Alastair said, there's so many different disciplines, you know, from law to finance, logistics, and all these kind of specialist areas where when you take that bigger lens, then you can really like be part of the global health community in whatever you're interested in. So I think it's much more of like a lens in the way you approach a topic than any particular list of defined topics. So if you want to go to the next slide, because I think this is like a useful map for people who are kind of just getting into global health. So I'll mention these different areas briefly, and these are kind of the big areas of global health which I've come across and worked in and have identified, but very happy to have things added to this. And when you take this kind of approach, it's also easy to think about how you could integrate it into things you're already doing. And also how you can have sustained involvement as well. So like have a career that takes that lens rather than do like a trip, say, and then, you know, forget about global health the rest of that time. So I think the first one is research. It can be like desk research or field research. Like I did research in Zambia, but I also do a lot of research in the UK from my room, and I think that's a really, really important player in global health. Picture below that, oh sorry, Siders is who I worked for, that's the picture there. The picture below that is a picture of Treatment Action Group, who are an advocacy group based out of South Africa. And I think it's really important to think about how advocacy groups, their role in global health. The civil society role in global health ranges from kind of big formal NGOs to small grassroots activists and everything in between. And kind of touching on the idea of system change and power dynamics, a lot of these problems require collective action. And so the role of civil society is really important. Below that is a kind of local think tank, but think tanks and policy are really, really important. So you have a lot of kind of like policy focus groups, different think tanks, thinking about the different ways in which policy can be harnessed for global health. And then at the top, you've got UNICEF, some civil service stuff, who are some of the people I've worked with a lot. And the public policy and civil service have obviously contribute a huge amount to global health, and that can be kind of national or international. So national level, you might look at health systems design, for example, and with UNICEF, I know they have like one of the biggest logistics teams in the world trying to get all their vaccines all over the place. And also I think within that, consultancy and project management also has a role to play, and you kind of span lots of different areas and cool organizations here as well. And then I think lastly is programs. So my experience with programs was mostly through my work with the British Foreign Office in Zambia. But kind of I wanted to put that last because that's what often comes to people's mind first, is like going and, you know, delivering healthcare in X country or whatever. But actually there's kind of a lot more that you can do all in between. But saying that, working on programs is really, really fun and exciting and interesting. So if you want to go to the next slide. I'm going to talk a little bit about, especially in kind of the context of not being able to go anywhere, how global health is very, very much an issue that can be worked on in whatever you're doing, wherever you are. So I'm going to talk a little bit about my work on climate change. So on the screen are a couple of different things that I've been up to, so I'll talk through those a little bit. So in terms of the relationship between climate change and health, I'm sure many of you are familiar. But yeah, as the Lancet identified it as the greatest global threat to global health in the 21st century. But it also has some really important justice and power dynamics. So high income countries are far more responsible for global emissions, and the opposite is true for those who are most affected. And the UK is one of the highest global emitters, both currently and historically. But also not just globally, health inequalities in the UK also reflect who has contributed the least to climate change and who is most likely to suffer as a result. And this also obviously has huge links to economics as well, and the way that we design our economic incentives. So in terms of how I've been working on this as a student, I work with the Cambridge and Peterborough Independent Commission on Climate, who are the local climate advisory group to the combined authority. So I'm one of the commissioners there, and we work on implementing climate change strategies for the region. And my particular role is looking at the health and inequality implications of those, and what a just transition would look like in our region. So taking that global perspective of the UK needing to decarbonise rapidly, but also factoring in local health inequalities in how we do that. And then some other work that I've done on this is especially around campaigning a lot through Students for Global Health. So the letter you can see on the bottom left is a Health Justice Means Climate Justice campaign, which we ran directed at the UK government, which focused on its duty globally to finance the transition away from fossil fuels. But we also kind of work on a national level as well. I have some meetings with MPs coming up in the next couple of weeks about why the health community would support a Green New Deal in the UK, and how we could implement a Green New Deal in the UK in a way that reduced health inequalities. And a lot of this work, kind of touching on the multi-stakeholder point, is that is a lot of movement building and collaboration involved. So you need to talk to think tanks, you need to talk to local communities, you need to talk to researchers, you need to talk to other advocacy groups. So there's a huge amount of collaboration in this as well. And yeah, if anyone has any questions about kind of how to get involved in that kind of work, happy to elaborate, but I don't want to talk too much about stuff that I've been up to. And then if you go to the next slide, this is my last slide, or penultimate slide. So another issue that I work on a lot is access to medicines. So this was the internship I did with Médecins Sans Frontières in their policy and advocacy department in Geneva. This is very much how I got into this issue. And I say it's a really, really fascinating interdisciplinary issue. You need a lot of lawyers, a lot of intellectual property lawyers are in this space, a lot of trade law is in this space. So yeah, it's a really, really interesting and very multidisciplinary space to be. And I think in this one, I think lots of the work I do has focused on research. So researching and trying to influence agendas and ideas and thoughts about where innovation comes from through doing research. So in the top left, you can see our study that was in The Guardian 2 weeks ago that researched the public funding behind the Oxford AstraZeneca COVID vaccine, which had made quite a big splash in the discussions about access to that vaccine, which was really fun to work on. And again, we just did that through like a group of friends and a student group organising effectively. And then some other work that I do is on advocacy with universities allied for essential medicines. But it's also really important to engage with politics on this issue. So we work with some other organisations to try and influence the UK government's position at negotiations like at the World Health Assembly or at meetings of the World Trade Organization, for example. So yeah, so hopefully kind of within that area, you can see how many different ways there are to get involved. And then if you go to the last slide, this is like a very nice diagram, which I always try and end lots of different talks on, and I think comes back to the point about, oh wait, the slide hasn't changed, I don't think. This is a really nice diagram. Oh, there we go, great, thanks. About kind of like the approach that I take to global health, and I think kind of builds on that point of systems change as well. And I think when we talk about global health, it's much more than saying, oh, you know, like this is a problem, this makes us sad, let's go and help these people, or whatever issue that you're working on. It's more about looking at the systems that we have, whether that be health systems, economic systems, environmental systems, and kind of asking the difficult questions about why people are sick in the first place. Is there injustice in the reason why they're sick in the first place? And how can we better design health systems? How can we better design policy and public policy to actually kind of create the societies that we want, particularly focused around health? So yeah, so that's it from me. I hope I didn't go too over time. But yes, you can stop sharing your screen.
Thank you very much, Rhiannon. Again, a really interesting talk from a slightly different perspective and way of being involved in global health. But as you said, some similar reflections could be drawn. We're now moving on to some questions. So do feel free to post them in the chat. Otherwise, we had some questions we brought